What makes us special at the Division of Sports Medicine at Boston Children's Hospital is that we really focus on the holistic care for the patient. It's important to treat the injury, of course, but also understanding why that injury happened in the first place and what can we do to prevent injury when return that patient back to sports and activities. The athletes that we treat are very varied. We see simple and complex injuries in kids from the region and all over the world. We see patients of all ages, so we really run the gamut in terms of the injury patterns that we see. Pediatric and adolescent athletes really differ from adult athletes. They're still growing, so they have open growth plates and their bodies are changing in terms of maturity. The psychological and emotional impact is different in the adolescent athlete. It's sort of the combination of different surgical techniques, understanding growth maturity, focusing on rehabilitation, injury prevention, that help us get good outcomes the first time. In sports medicine at Boston Children's, we have sports-specific programs. These specific programs let us become more multidisciplinary, so we have sports psychologists, we have sports nutritionists, trainees, residents, medical students, and fellows all working on the team. And by having these specific programs, it really lets us treat the patient in a more holistic way. We get better outcomes. But then, how do we prevent that injury from happening in the future? We have the McKaylee Injury Prevention Center. We have strength conditioning specialists, injury prevention specialists. With their rehab, we test them to see if they're ready to return back to sports and activities. It's a big focus for us in the Division of Sports Medicine, and I think is one thing that really sets us apart. We're really on the cutting edge in terms of surgical techniques, and we're publishing hundreds of papers in the scientific literature every year. We're getting research grants. I think how that translates to patient care is that we're giving patients the best and most modern and optimized care, and we're constantly innovating and trying to improve on our outcomes. My hope for a patient who receives care at the Division of Sports Medicine is that they feel well cared for holistically, to be able to return back to sports and activities without re-injury, and to have long-term health in really their whole body and their whole mind.